In technology news, according to a 2021 report, 80% of white adults report owning a laptop or desktop computer in comparison to just 69% of black adults and 67% of Hispanic adults. Community Access is working to address the digital divide with an expansion of opportunities and services for the people that they serve. And here now we've got sharing more information, the CEO of Community Access, and we've got Cal Hedigan. And thank you so much for being with us.
Thank you so much for having me. I'm excited to be here.
Yeah, thank you. The numbers are kind of, well, it's kind of startling to some extent to look and see that there is, first of all, that gap, and then second of all, to understand that, you're talking about nearly when it comes to the African American community, 7 out of 10 possibly have access to computers. While some people may say that's good, when you look at the statistics and you start merging them together, this divide is very real.
No, it really is. And I think one of the things we really learned during the early and middle of the COVID-19 pandemic, as services, so many services switched to virtual services, the impact of that digital divide on people who don't have access either to the equipment or the internet connectivity was really amplified. And it really made it so clear how important it is to close this divide so people are not cut off from opportunities, both for health and mental health care, but also training, education. So many things in our world today depend on being able to connect virtually.
Can you make our viewers just a little bit more aware? Because when we talk about a digital divide, sometimes people aren't so familiar. So let's break down what that actually means for people within the community to be a part of a digital divide. What does that look like?
I think it looks like having more than a smartphone. So access to a device, whether that is a laptop computer or a standalone computer. It also means connectivity, the ability to reliably connect to the internet. And it also means having the skills and the familiarity with this technology in order to be able to use it in your day-to-day life.
Yeah. And so, Cal, you're the CEO of Community Access. Talk to us about Community Access and the work that you do.
Thank you. I'd love to. Community Access is a New York City-based nonprofit. We serve people with mental health concerns in a variety of ways. We began as a housing organization. Today, we have over 1,600 units of supportive and affordable housing across 3 New York City boroughs, serving people living with mental health concerns who also have experienced homelessness, and affordable housing for families from the community. In addition to our housing, we have a variety of other services that serve people living with mental health concerns, including a job training program that helps people become providers of services within the mental health system, a supported education program, and a variety of mobile teams that serve people who are disconnected from care and experiencing homelessness, and a number of other ones I won't go on, but they are all geared to helping people who have been identified as having a mental health concern live successfully and thrive in the community.
For those who don't know, take us a little bit deeper, because when we talk about some of the challenges that your population that you serve really deals with, talk about some of the challenges that your constituents are having that you're actually able to really bridge the gap on.
Well, as I mentioned, one of the core of what we do is supportive housing. And so what that is housing with on-site service supports to really help people thrive, identify goals that they have, connect them to services that they may want, and from that sort of very stable foundation of housing, just be able to look at all the other areas of their life that they might want to change how things are going for them now, whether that might be reconnecting with family, that might be restarting an education, that might be, deciding on a training program for a career path. But it's really about working with people where they are, finding out what they want in their lives, and trying to facilitate them, helping them on that journey.
And so, for people who want to get more information to be connected, and maybe they're watching a program right now and saying, "Listen, I could really use some help. I'm part of that digital divide. I need some assistance." What do they do?
Our website is communityaccess.org, and on there there's a full sort of array of information about our services and how to connect to us.
Yeah, I know one of the things that you also deal with is, you talk about the digital divide, but also healthcare access, right? And that's very huge, and that's a topic of discussion. Can you give us some insight as to how you're able to really connect the dots for people in the area of healthcare? Because we can talk about what COVID has produced, and we can see how that divide really plays out.
And I just want to go for a minute because obviously I forgot to mention our digital equity initiative in terms of our services. We have a grant right now to connect 300 of participants in our services with computers, with connectivity, and with digital literacy education. And one of the reasons that we're doing that is to help people access healthcare. So as I mentioned earlier, there's so many more opportunities to connect virtually for these healthcare services in the community. It's much easier to get a timely appointment. And if people don't have either the familiarity with how to log on to or the equipment, that's just yet another barrier to people accessing the healthcare services that they need, whether it be primary health or mental health and well-being.
Yeah. And so if somebody doesn't have access to these resources and say, for instance, I don't have a laptop, I don't have a computer, there are programs, and I know that you're very much, in the know, that can actually connect people to being able to have these, right?
Yes. The one that we're using is through a grant, but we also do make efforts to attempt people who might not even have a cell phone or smartphone technology, because that can be a real point of entry for some people in order to be more familiar with connecting to the internet, using the internet. So that's one of the things. We connect people to low-cost mobile phones. And we also have we have computer labs in all of our housing sites. Where people, it's a little like the library model, where people can go into our computer labs and learn skills and connect to virtual services through the on-site computer labs.
For yourself, what have you been seeing that maybe you can give us some little behind the scenes on? Because with the client population that you have, so many times we're not always fully abreast of the things that are going on. Are there some common threads that we're seeing amongst the community that maybe we need to be paying attention to?
I think really trying to get rid of all of these barriers to access, where people may be living in under-resourced communities where broadband in and of itself is an issue. I know New York City has a broadband plan, but there are many communities where even if you have a Wi-Fi connection, because of the lack of the infrastructure in the city, it makes it that more challenging for people to be able to live and in a digital universe, for lack of a better term.
Yeah. Well, Cal, I want to thank you so much for joining us and sharing a little bit about what's going on. And great job in trying to close that digital divide, because it is real. Thanks much.
Thank you so much.
All righty. Well, I want our viewers to know, if you want more information, please go ahead and visit the website at Community Access. I'm losing my earpiece right here, but I'm going to be able to hear. Communityaccess.org. Encourage you, don't go anywhere. We got more open coming up right after this.